The UK is facing a social care crisis, and we're not alone. Around 6,000 miles away, Japan is also grappling with the question of how to care for its ageing population, with the added complication of a low birth rate and shrinking overall population, which means there are fewer working-aged people to meet the rising tide of demand for care. Unlike the UK, however, where successive governments have tried and failed to create a system that is fair and sustainable, Japan has grasped the nettle of reform on this complex issue. I'm Hanna, the Daily Express's health editor, and I've come to Japan to find out a bit more about this country's attitude towards ageing and its long-term care insurance system, which is considered to be one of the best models in the world. As well as being a health journalist, I'm half Japanese, and my family has personal experience of social care in both the UK and Japan, so I'm really interested to find out a bit more about how things work here. We received a very warm welcome at Michiai Nursing Home in Kawaguchi City. This facility houses 29 residents, most aged over 90, as well as a day centre on the ground floor where elderly people still living in the community can come to take part in activities that are designed to preserve their health. Bocce and origami encourage movement and fine motor skills. Members can take part in physical therapy sessions, and karaoke exercises the lungs. Care for the elderly in Japan is paid for through a combination of state funding and insurance premiums paid by those over the age of 40, under a system that was introduced in the year 2000. The idea was that by the age of 40, most people would be financially stable and also a bit more aware of the kind of care that they may need later in life, and therefore willing to pay into the system. If and when they need care, the majority of Japan's residents pay only 10% of the costs, regardless of their financial assets. Kawaguchi City's Director of Social Welfare, Yuichi Sakamoto, says the changes took pressure off of families by creating a fairer funding system.
ですね。介護保険制度ができまして、これまで家族がケアをしていたところから、社会全体で介護保険制度として高齢者を支えていくという感じになりましたので、それによってこれまで介護が負担になって仕事ができなかった人がどんどん就業できるようになったと考えています。
Kawaguchi City has a population of around 600,000 people, and 23% are over the age of 65. The national average for that figure across Japan is 30%, compared with around 19% in the UK.
日本の介護保険制度は全体のその費用の半分を税金で賄って半分を保険料で賄うということで、かなりその安定した財政基盤をまず用意しています。これが一つです。で、それからサービスの種類も施設に入る、ここの施設みたいな一つの施設に入るっていう形だけではなくて、家で受けられるサービスとか、デイサービスのように通って受けられるってかなり多様なサービスを用意しておりますので、先ほど言ったその財政基盤の安定化と、あとサービスの種類を増やしていくっていうことが重要なんじゃないかなと思います。
At another care home, Daini Shunkoen, we see more of the highest quality nursing care Japan has to offer. Here we meet Sachiko Ishii, a former teacher who tells us she could not be better looked after.
この言い方のおかげで94。親より兄弟より一番長生きしました。
Sachiko shows us written exercises she does to promote good brain health and says she loves the meals, which are meticulously planned in terms of nutrition and portions.
毎日おいしく残さずいただいてます。
Perhaps unsurprisingly, the services that we saw during our time with health officials in Kawaguchi City were excellent. But our hosts were also honest about the fact that this funding system is under threat. In the future, it may need to start taking into account people's financial assets as the number needing care continues to soar. The country is also experiencing similar problems to the UK with staff shortages. A survey last year suggested 70% of care service providers in Japan were facing labour shortages, with the sector struggling to attract workers due to its low wages and heavy workload. A world leader in technology, Japan is also looking to robots and the latest devices to ease the burden on its care workforce. At Shintomi Nursing Home, run by the Silverwing Social Care Corporation, both staff and residents are embracing cutting-edge innovations. When we arrive, a humanoid robot called Pepper is leading an activity session for around 30 day centre attendees. She sings, dances, and plays videos. Meanwhile, upstairs, an 83-year-old woman is using a walking assist device designed by Honda. Sensors detect the movement of her hip joints, then drive motors which guide the swinging of her lower leg. She tells us, "My legs feel lighter." Other technology in use includes a device worn by staff to help them safely lift heavy loads, a digital mirror that guides users through exercises to improve balance and coordination, and a wheelchair that can go up and down the stairs. Kamiya Ishikawa, Silverwing's chief executive, says he believes robots can improve working conditions for the nation's overstretched workforce.
今働く人の雇用環境の問題が非常に問題になっています。そういうことをですね、これから日本の高齢化介護施設がですね、介護施設を持続可能なものにしていくためにはですね、改善していかなければいけないと思っています。そのためにはですね、一つはテクノロジーを導入してですね、より働きやすい職場の労働環境を実現していくと。やっぱり今、私どもではこのためにですね、いろいろと介護ロボットを導入したりしています。
Although the technology is fascinating, it's clear that robots are not a silver bullet to fix staff shortages. So another focus in Japan is on keeping people healthy and independent for as long as possible. The country has an average life expectancy of 81 for men and 87 for women, compared to 79 and 83 respectively in the UK. The Japanese diet is often cited as a key factor, but I was also impressed by initiatives to encourage older people to remain socially connected and active in their communities. On a bitterly cold morning in Tokyo, around 100 pensioners have gathered at Nezu Shrine to take part in Radio Taiso. Every morning at 6:30 a.m, millions of people across Japan follow along with broadcast instructions for a simple calisthenics routine to start the day. Attendees, including a 96-year-old man, tell me that being part of this group ensures that they get out of the house every day and helps them maintain a good routine and friendships. Many elderly people who live at home but need extra support also attend day centres. In Hachioji, we visited Days BLG, an incredible day service for those living with dementia. Each day, members arrive and choose from a list of jobs in the community during a morning meeting. They have a quick health check, and then it's time to get started. Today, half the group is heading to a local Honda dealership where they're paid a small amount to wash cars. Working in a well-practiced routine, they scrub each vehicle until it's shining. Meanwhile, lunchtime is underway at a nearby community kitchen. 77-year-old Iwao Kuboki is a former chef who has lived with dementia for around 10 years. At times, he is quiet and withdrawn and takes time to find the right words to express himself. But he appears in his element while working in the kitchen and cooking up 2 steaming batches of delicious curry. The group's members are supported to open the curry restaurant twice a month. Today, a 51-year-old woman with early onset dementia is in charge of salad and pickles, while 2 others are working as waiters. Mizuno Hideji, 62, greets every customer with a beaming smile, in a manner perfected during his former career as a restaurant manager. He tells us he was diagnosed with dementia last year after having difficulty finding the right words and losing track of what he was doing.
本当はもう何もできないと思ってたんで、できないので、こういう形になって、またやることができたということはすごく嬉しかったです。何もなかったら、家に、ね、いるだけになってしまう。で、週に3日、火、木、土で、こちらの方に、来てる。その時にはもうほとんど外に出たりとか、いろいろあるんで、やっぱり、なんか一 一人ぼっちになるようなそんなようなことはないんで、それでやっぱり皆さんと一緒に楽しくやってるっていうことですね。
All of the money earned from these jobs is divided between the members. They pay a small fee to come to the day service, ranging from 800 to 2,800 yen, which is between £4.25 and £14.85. The price depends on a person's care needs and their income. For most members, this fee covers 10% of their overall costs, with the rest paid by the long-term care insurance system. BLG Hachioji's leader, Takuya Maria, says people with dementia are too often told what they can't do.
やっぱそれがおかしいと思うし、なんでそのボーダーラインを引いて、特別な人として何もできない人っていう風な見方をする、できることも奪ってしまうっていうね。認知症にならない人でも孤独、孤立する危険性って多くあると思うんですよね。当たり前にその地域でその暮らしていくっていうことの中に、やっぱりその人とつながるっていうこともすごく大事かなって思うので。
The UK is currently in a similar position to Japan in the 1990s, struggling to provide adequate care for a growing elderly population, with many pensions forced to cover their own care costs until they fall below the threshold for local council support, or go without. There is a growing consensus that reform is needed, but proposed policies to improve the system have repeatedly failed or been delayed. During our trip, we've seen firsthand how Japan has embraced change and taken action to put its elderly care system on a more sustainable footing. It's not a perfect solution, and it's not as simple as suggesting that Britain could copy this model exactly. Nonetheless, there is clearly a lot that the UK could learn from the way Japan is facing this challenge head-on, as well as its attitude towards ageing and helping older citizens to remain independent and active in the community for as long as possible.